Good morning. Please come in and have a seat. How can I help you today?
Good morning, Doctor. I've been feeling unwell for a few days and I thought I should come in.
I'm glad you did. Can you tell me what's been bothering you?
Well, I've had a persistent headache and I feel extremely tired all the time.
I see. Is this the first time you've felt like this? Or have you experienced similar symptoms before?
It's the first time. It started about 4 days ago and it seems to be getting worse.
All right, let's try to break this down. Besides the headache and fatigue, are you experiencing any other symptoms?
Yes, I've also had a mild fever, a sore throat, and some muscle aches, especially in my back and legs.
Have you noticed any coughing, nasal congestion, or difficulty breathing?
I do have a slight cough, but it's not severe. No congestion or breathing problems, though.
That's good to hear. Have you felt dizzy or nauseous at any point?
Yes, I've felt a little dizzy, especially when I stand up too quickly, but no nausea.
How about your appetite? Have you been eating and drinking normally?
Not really. I've lost my appetite, and I've been eating very little. I'm also struggling to stay hydrated because I just don't feel thirsty.
Have there been any recent changes in your routine, like traveling, work stress, or changes in your diet?
Yes, I just returned from a business trip last week, and I've been working long hours since then. I haven't been eating or sleeping well because of the workload.
That could certainly contribute to how you're feeling. During your trip, were you exposed to crowded places or anyone who seemed sick?
Yes, I had a long flight, and the airplane was quite full. I also attended a conference where many people were coughing and sneezing.
That increases the likelihood of a viral infection. Have you been vaccinated for the flu this season?
No, I didn't get the flu shot this year.
Let's do a quick examination. I'll check your temperature, blood pressure, and listen to your chest. Your temperature is 38.5 degrees Celsius, which is a moderate fever. Your blood pressure is slightly lower than normal, which could explain the dizziness. Your chest sounds clear, but your throat is inflamed and slightly red. Can you open your mouth and say, ah?
Ah,
Your tonsils look a bit swollen, but there's no sign of pus, which is good.
so what's your diagnosis, Doctor?
Based on your symptoms, it seems like you're dealing with a viral infection, most likely the flu. However, we'll need to rule out any bacterial infections. I'll order a blood test and a throat swab to be sure.
Is it something serious?
Not at all. It's quite common, and most people recover fully within a week. With some rest and proper care, you'll feel better soon.
What should I do to recover faster?
I'll prescribe medication to lower your fever, relieve your sore throat, and reduce muscle pain. It's also important to stay hydrated, eat light but nutritious meals, and get plenty of rest.
Should I avoid any specific foods or drinks?
Yes, avoid caffeine, alcohol, and very spicy or acidic foods. Stick to warm soups, herbal teas, and easily digestible meals like steamed vegetables or rice.
Should I take any vitamins or supplements?
A multivitamin or a vitamin C supplement could help boost your immune system, but it's not mandatory. Fresh fruits and vegetables will provide most of what you need.
Is it okay if I go to work while I'm recovering?
It's best to stay home for at least 2 to 3 days to avoid spreading the virus to others and to allow your body to rest.
Can I exercise during this time?
Light stretching or yoga is fine if you feel up to it, but avoid any strenuous activity until you're fully recovered.
How about drinking cold water?
It's better to stick to room temperature or warm liquids to soothe your throat. Cold drinks might irritate it further. I'll give you a prescription for the medication and a note for your employer. Do you have any other questions or concerns?
No, I think that covers everything. Thank you so much for your time, Doctor.
You're welcome. Take care of yourself, and don't hesitate to come back if your symptoms persist or worsen.
Thank you. Have a great day.
You too. Get well soon.